on healthcare, you're seeing a new development that's really important this week. The reporting by the New York Times and the Post shows that the coronavirus is infecting and killing African Americans and Latinos at an alarming rate.
We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans.
Yasmeen, this was on the front page of many newspapers. It's a development that leaders across the country are grappling with. When you look at the data and you talk to your sources, what are you learning about why this is happening?
I think, there is an understanding that a lot of this comes down to systemic inequities between minority communities and white communities. Part of this is that, some states only recently started collecting data based on race. So much of the early response was focused on tests and getting tests to certain places, but you didn't think about and address some of these inequities that are inherent to, the U.S. healthcare system. And part of it is, as Dr. Fauci said in that clip, that pre-existing conditions like diabetes and hypertension occur in higher rates in minority communities, and we know that the coronavirus is especially risky to people who already have underlying health conditions. So you see all of that starting to sort of take effect. This data is still not very comprehensive, so you've seen a lot of lawmakers calling for better data, so that the administration can start to think about ways to address this.
Amna, when you listen to what Yasmeen just said, and you think about all your reporting over the years about healthcare access, the burdens of care, what are you seeing right now with this pandemic in communities of color?
I mean, Yasmeen's absolutely right. The numbers don't lie, and they paint a really astonishing picture, even with the patchwork of data that we have so far. And we should be clear, it's limited early data. We're relying on states to offer up that information, to collect it in the first place, complete or incompletely, and then offer it up. The federal government is not collecting it right now, and they're not releasing it in a comprehensive way. But you just take Mississippi, for example. I was talking to Governor Reeves yesterday. In Mississippi, African Americans make up less than 40% of the state population. So far, they make up over 70% of all COVID-related deaths. They also make up a majority of the infection rate. And we know this is happening across the country in places like Michigan and Ohio, in Virginia and North Carolina. Some cities have started releasing that data too. Yasmeen's absolutely right. There's a higher chronic burden, health burden carried by African Americans in particular. But it's also a matter of when they are able to access care, there's a minimizing of pain. There's a dismissing of symptoms there. All of those things will lead, according to the experts I've talked to a profound mortality and morbidity rate among this one community. And one of the reasons it's important to get that data across the country is so you know where to surge the resources when you do get them.
John, there was an exchange today between our friend Yamiche Alcindor at PBS and the Surgeon General about this exact issue. When you talk to your sources at the White House, are they confronting this? Are they dealing with this in the Trump administration?
Well, it certainly caught their attention, but look, these figures are a reflection of inequality in America and about the racial outlines of that inequality. And I think it's going to be a similar situation as you look at the economic impact. We have had now some 16+ million people file for unemployment benefits just over the past 3 weeks. As you know, how so many Americans get their health care coverage through their employer. This is an economic crisis and a health care crisis that is intertwined very closely.
That's such an important point, because when you think about the economic crisis, these dual crises in healthcare, Karl, it all ties into, including the racial disparity, with this congressional showdown over funding. In brief, here's what we all need to know. The Trump administration wants to shore up the $2 trillion stimulus package with an additional $250 billion for small businesses. But Speaker Pelosi and Democrats want guarantees from Republicans that half of that money would go to minority-owned businesses and community banks, and they'd like to see another $250 billion for hospitals and states. Senate Republicans and Democrats both tried to pass their versions of funding late this week. Both efforts failed. Karl, the issue about race, about who's going to get access to capital, they persist, not just in the health front, but also on the economic front. What's next on Capitol Hill as they continue to negotiate about small business funding?
Yeah, you know, you can't quarantine partisanship, and we saw some of that happen this week. I think, you know, one of the interesting things to me about this, Bob, is that Senator McConnell has been very successful in moving judges on a majority vote. He's gotten very used to doing things on a majority vote. Now he's having to face Democrats who have real leverage in this because he needs to get 60 votes for legislation. So they're going to press their advantage, and they, you know, what happened was the Senator McConnell in the White House wanted a straight through $250 billion for small businesses. The Democrats said, hey, wait a minute. We want to take care of some of the problems that we see there too. Got into a stalemate. I actually do think that they're going to work this out probably by next week. Democrats are dealing with Secretary Mnuchin, who's their favorite partner. They really like dealing with him. And I think then the bigger fight coming down the road is this so-called Phase 4. That'll be a much broader thing. But Democrats, they are not going to just sit there and say, we're going to take what the White House wants. I think one of the fascinating things about this epidemic is how it has crystallized some of these divides that we've had in the country. And I think Democrats see that, and going into election, they want to make sure that they take care of who they see as their folks.
Yasmeen, Karl just mentioned Phase 4, the next round of talks. And I spoke to Speaker Pelosi this week, and she says hospitals need billions of dollars. When you talk to your sources, based on your reporting, where are the needs as Congress starts to look ahead to Phase 4 in terms of healthcare? Where is money needed right now as the pandemic continues?
Well, hospitals are seeing, disproportionate numbers of ICU patients and patients who are staying in the ICU longer than usual. Insurers have waived fees for testing, and some insurers have waived certain money for types of coronavirus treatment. But I think the biggest thing is that hospitals are just seeing a huge surge of patients. Many of them are Medicare patients, so the payments are lower than in private insurance, and that these ICU stays are longer, and the ICU is, of course, very expensive. So, a lot of hospitals, especially rural hospitals or hospitals in smaller communities, say they're really bleeding money trying to respond to this crisis and don't have enough resources. A lot of people here have talked about need for supplies, protective equipment, ventilators. There are shortages of just about everything right now. And of course, they've got staffs that, need to work overtime. For some of these tests that you're sending out, you need technicians. Actually operating these tests is very expensive. So the need is sort of spread throughout, but especially for these smaller hospitals, I think they say they're really hurting and they're really bleeding money as they're trying to respond to this crisis.